For people who have pinched nerve symptoms, which are typically neck pain that radiates down into your arm, may make some fingers numb and tingly, may give you some weakness in your arm when you're pushing a door open or trying to pick up a bag, and making life difficult because usually it's uncomfortable. It's uncomfortable all the time. It gets worse when you move your neck in certain positions. A lot of people have trouble sleeping. And sometimes the pain is horrific. It's really bad, and people come in sometimes with their hand supported on their head because that shortens up the nerve a little bit and makes them a little less uncomfortable. But the pain can be miserable at the very beginning, or it can last for several weeks and it's just not getting better. Fortunately, most people do improve with time, with rest, with anti-inflammatory medicines, sometimes with injections, with a collar, with physical therapy. But for people who are not getting better, it's a good idea to talk to a spine surgeon. If you've not had an MRI scan, that's a good time to get one after several weeks and have that reviewed and see whether you're a candidate for surgery. There are different ways to relieve the pressure on the nerve, but a very common way to do that is to remove the disc from the front of the neck because that takes away the damaged disc and it lets us get back and pull the part that's pushing the nerve away from the nerve without having to bother the nerve or the spinal cord directly. But then we have to put something in its place, and if we put in something solid, that becomes a fusion, and you lose the motion at that segment, that one level. Because your neck moves at so many places, you may not notice much of a difference, so a single level fusion often leaves you with a reasonably good range of motion. But many people don't have to have a fusion. They can have their disc removed and the nerve decompressed, but then have an artificial disc replacement put in, and that maintains the motion at that level. It will keep the other levels from having to compensate and wear out sooner, and the recovery is quicker. So many people could be a candidate for both a disc replacement or a fusion, and you should learn about what the advantages of each are so that you can make an educated decision.